Coronavirus Task Force has the CDC looking at the issue of masks as a protective measure right now?
It is a personal choice, and if people feel that they want to make a cloth mask and wear a cloth mask, that is perfectly within their purview.
I would say that absolutely, no matter what you do with that kind of a covering of your nose and mouth, you have to practice what we know works, which is that physical distancing, hand washing, and not touching your face.
This issue that I know is an ongoing conversation amongst professionals and health professionals around the world.
Lots of talk from politicians about the general public using face masks. But what do doctors say? We've convened a couple of them to talk about this issue with us. So Dr. Michael Lin is Associate Professor of Neurobiology and Bioengineering at Stanford University in California. Thank you, sir, for joining us. And in Toronto, I want to welcome Dr. Iris Gorfinkel, a family doctor and clinical researcher with an interest in vaccines. Thank you both for joining us. Dr. Lin, may I start with you? Just simply, who should be wearing a mask right now?
Well, I would say right now, if you're a sick person, you should definitely wear a mask. If you are exposed, you have the potential to be exposed to sick people, or you're going to be in a crowded place, then I think it's actually a good idea at the current rates of infection to wear a mask as well.
So not the general public, if you feel concerned, should you be wearing a mask?
Well, I would say it really depends on how much exposure you expect to have. If you're going out for a walk by yourself and you're unlikely to meet a stranger, then I would say you don't need a mask. But I think at the rates of infection that we're seeing now in North America, if you're going to a more crowded location, if you're going to run into multiple people, it would be a good idea to have a mask with you and be ready to use.
Dr. Gorfinkel, let me get your opinion on this. What do you think?
I want to give a bit of an overview of the pros and cons. You know, I'm a family doctor, and generally I have followed what the CDC and the World Health Organization has recommended, which is don't tell patients to wear masks because they touch their face more when they have them on. That said, we're dealing with a completely different situation with COVID-19. We see something that's far more infectious than influenza, that has a death rate that's rapidly, that's actually known to be worse, and that the problem with the CDC and the World Health Organization is they've never really looked at the kind of homemade masks that are now becoming so popular. The problem with homemade masks, of course, is that they're many things. They're different fabrics, they're different weaves, they're different fits. So it's really hard to make a scientific statement about them.
Now, Dr. Lin, I want to bring this in, that there are some other countries, European governments in particular, who are choosing to follow pro-mask policies. Austria on Monday, they're saying that they ban the members of public from entering a supermarket without one. The Czech Republic requires everyone to wear this in public, and the CDC in the U.S. is also considering whether to revise the guidelines. So when I think viewers hear all this, I think they go, well, maybe I should too.
Yeah, well, I think the situation is rapidly evolving. Here in the U.S., we were told by the CDC following the directives of WHO that the general population does not need to wear masks, and we were told the reason was that it wasn't effective. And I think there's a problem with that messaging. Masks are effective both in preventing transmission from sick people and in avoiding inhalation of particles by healthy people. But the CDC has been trying to convince the public that they don't need the masks, and I think this message has made people very confused. Most of the motivation behind not recommending masks is that with a very low rate of infection in the community, most of the masks would be wasted if they were used by people in public. But as infection rates rise and slowing the rate of new infections becomes important, then masks can be a very useful part of the strategy.
So let me ask then, and Dr. Gorfinkel, let me bring you in. Let's talk about, there's a distinction too, because there's the N95 mask and then there's the regular surgical mask. Can you help us with that?
Absolutely. So we're talking about how well these masks are able to filter virus particles. And the N95 is considered sort of the gold standard in that filtration. And that's recommended only for high-risk procedures by healthcare providers. The problem what we now face is that the standard surgical masks are in extremely low supply. So even for myself, I've been on back order in my own personal office for about 6 weeks on masks now. That's a disaster public health wise, because normally we'd slap a mask on somebody as soon as they came into the office with an infection, and that's not possible. So what we're talking about, if there's to be a change in the guidelines at all, it's not talking about surgical masks, nor is it talking about N95 masks, because all healthcare facilities are currently suffering a severe shortage of them. So that's a problem. So we're talking about the potential benefit of homemade masks, which in fact are not a single thing, but as many and as varied as people will make them.
Absolutely. Dr. Lin, one of the things you're talking about is that, these masks may not help if you already have symptoms, but there are people who are asymptomatic, presymptomatic. Does that sort of change the calculation as to whether you should wear one? Because you may not know that you have the coronavirus.
Yeah, that's a really good question. But first, I should just correct something you were saying. The masks do really help if you're symptomatic or sick, because they prevent you from giving it to other people. And masks are at least 95% effective in blocking the transmission of respiratory droplets from infected people. They're also effective at preventing the inhalation of particles if you're a healthy person. One reason that health authorities hadn't recommended wearing the masks is because they figured that sick people can put one on, and healthy people wouldn't need it if sick people were not around. But now we understand that about 25 to 50% of the transmission of the COVID-19 disease occurs from people who have no symptoms or have not yet shown symptoms. And so that changes the equation dramatically, because now you don't know if you're sick yourself, and you don't know if somebody you're talking to might be sick. And so to prevent spread between...
Oh, yeah, sorry. Let's get you in there, Dr. Gorfinkel.
So sorry. I just have to correct something that I've heard, which is actually not accurate. So the data is this: 25 to 50% of patients who are infected with COVID-19 are asymptomatic. Okay, that's not to say that 25 to 50% of people who contract COVID-19 get it that way. That we don't know what percentage actually contracted from asymptomatic individuals. But what we do know is that there is asymptomatic viral shedding happening, and that is an argument that favors wearing a mask. But that said, it's not the same statement. So 25 to 50% of individuals infected with COVID-19 are in fact asymptomatic. We don't know how many of those are actually pre-symptomatic. In other words, they're going to develop symptoms but haven't yet.
Dr. Lin, did you want to jump in there too?
Oh, yes. I was going to say that Dr. Gorfinkel is entirely correct that 25 to 50% of people who have the virus are asymptomatic at the time of testing. But it's also true that in models of how the virus is spread, there's an estimate that about 33% of the virus spread has been due to asymptomatic people. That's, of course, varies from society to society, but that's actually a look at the initial infection throughout China. So there is this concern that a large fraction of the epidemic is being spread through asymptomatic people.
I just want to ask you both this question. We've heard a lot of different things from our leaders, our government leaders, as to whether you should or you shouldn't. So, Dr. Gorfinkel, what do you hope that the leaders would be saying right now?
I think in an ideal world, we'd all wear masks all the time. I think there is a sense to that. But the reality is this: right now, we are suffering a severe shortage of masks. To say that homemade masks are just as effective as N95s is not only misleading, but it's also wrong. We know that individuals will touch their face more frequently, will touch their eyes more frequently, their mouths, because they're wearing a mask. And that could, in fact, cause a problem in terms of disease transmission. These are scientific statements, and we look to the CDC and the World Health Organization not for, what do you think? What's your guess? They're supposed to look at hard data. It doesn't make a difference. To say that a t-shirt across your face is going to block 95% of virus particles from passing through is simply a falsehood. That is not